Myocarditis. Introduction. Myocarditis is an inflammatory condition of the heart muscle, myocardium, which can affect the heart's ability to pump blood and may cause arrhythmias. It can range from mild disease that resolves without treatment to severe cases leading to heart failure, cardiogenic shock, or sudden cardiac death. Myocarditis often affects young, healthy individuals and can be caused by infections, autoimmune diseases, or toxic substances. Early recognition and management are crucial to prevent complications. Definition. Myocarditis is an inflammatory disease of the heart muscle, diagnosed by established histological, immunological, and immunohistochemical criteria. Myocarditis is an inflammation of the myocardium, often caused by infections, autoimmune responses, or toxins that lead to myocardial injury and dysfunction. Risk factors. Viral infections, Coxsackie virus, adenovirus, influenza, COVID-19. Bacterial infections, Streptococcus, Staphylococcus, Lyme disease, Borrelia burgdorferi. Fungal infections, Candida, Aspergillus, in immunocompromised patients. Autoimmune diseases, systemic lupus erythematosus, SLE, rheumatoid arthritis. Medications and toxins, chemotherapy drugs, antibiotics, alcohol, cocaine. Immunosuppression, HIV/AIDS, post-organ transplantation. Etiology. Viral infections, the most common cause worldwide, viruses attack heart muscle cells causing inflammation. Bacterial infections, rare but serious, includes diphtheria, Lyme disease. Fungal infections, seen in immunocompromised patients. Parasites, Chagas disease, Trypanosoma cruzi. Autoimmune diseases, the body's immune system attacks its own heart tissues. Toxins/drugs, chemotherapy, cocaine, and alcohol can directly damage the heart muscle. Classification. 1. Based on cause. Infectious myocarditis, caused by viruses, bacteria, fungi, parasites. Non-infectious myocarditis, due to autoimmune diseases, toxins, hypersensitivity reactions. 2. Based on duration and severity. Acute myocarditis, sudden onset, severe inflammation. Chronic myocarditis, persistent inflammation leading to long-term heart damage. 3. Based on pathology. Lymphocytic myocarditis, most common, usually viral. Eosinophilic myocarditis, associated with hypersensitivity reactions. Giant cell myocarditis, rare, severe, and rapidly progressive. Pathophysiology. Entry of infectious agent, virus, bacteria, toxins, autoimmune trigger. Down arrow. Direct injury to cardiac myocytes. Down arrow. Activation of immune response, cytokine release, inflammation. Down arrow. Infiltration of inflammatory cells into myocardium, lymphocytes, macrophages. Down arrow. Myocardial edema and necrosis, cell death. Down arrow. Impaired contractility and electrical disturbances, arrhythmias. Down arrow. Reduced cardiac output and heart failure symptoms. Down arrow. Chronic remodeling and risk of dilated cardiomyopathy, in severe/untreated cases. Clinical manifestations. Chest pain, often mistaken for heart attack. Fatigue and weakness, due to reduced cardiac output. Shortness of breath, dyspnea especially on exertion. Palpitations and arrhythmias, irregular heartbeats, sometimes life-threatening. Edema, swelling in legs, ankles due to heart failure. Syncope, fainting due to arrhythmias. Flu-like symptoms, fever, body aches in viral myocarditis. Diagnostic evaluation. Medical history and physical examination, assessment of symptoms and risk factors. Electrocardiogram, ECG detects arrhythmias, conduction abnormalities. Echocardiogram evaluates heart function, wall motion, and ejection fraction. Cardiac MRI, detailed imaging to identify inflammation and scarring. Blood tests, elevated troponins, cardiac enzymes, C-reactive protein, CRP, erythrocyte sedimentation rate, ESR, viral serology. Endomyocardial biopsy, definitive diagnosis in uncertain cases, shows inflammation and damage. Chest X-ray, checks for heart enlargement and pulmonary congestion. Medical management. Antiviral medications, for specific viral infections, if identified. Anti-inflammatory agents, corticosteroids in autoimmune-related myocarditis, example prednisone. ACE inhibitors, example enalapril, lisinopril reduce afterload and prevent remodeling. Beta blockers, example metoprolol, carvedilol control heart rate, reduce oxygen demand. Diuretics, example furosemide, spironolactone manage fluid overload. Antiarrhythmic medications, example amiodarone control serious arrhythmias. Intravenous immunoglobulin, IVIG in severe or autoimmune cases to reduce inflammation. Mechanical support, in advanced cases, example intra-aortic balloon pump. Surgical management. Implantable cardioverter defibrillator, ICD for patients at high risk of sudden cardiac death due to arrhythmias. Heart transplant, in end-stage cases not responding to medical management. Rehabilitation and supportive care. Cardiac rehabilitation, supervised exercise programs to improve heart function. Psychological support, counseling for anxiety and depression related to chronic illness. Dietary management, low sodium, heart-healthy diet. Patient education, medication adherence, lifestyle modification, infection prevention. Nursing management. 1. Decreased cardiac output related to myocardial inflammation and impaired contractility. Interventions. Monitor vital signs frequently, blood pressure, heart rate, respiratory rate, oxygen saturation. Assess for signs of heart failure, example shortness of breath, peripheral edema, fatigue. Monitor heart sounds for gallops, murmurs, or irregular rhythms. Administer prescribed medications, example ACE inhibitors, beta blockers, diuretics, to improve cardiac function. Encourage bed rest and limit physical activity to reduce cardiac workload. Monitor intake and output, daily weight to assess fluid balance. 2. Activity intolerance related to decreased oxygen supply and fatigue. Interventions. Assess the patient's response to activity, including heart rate, blood pressure, and fatigue level. Plan care to allow rest periods between activities. Encourage gradual increase in activity as tolerated. Teach energy conservation techniques, example sitting while bathing, pacing activities. Monitor for signs of intolerance such as dizziness, dyspnea, palpitations. 3. Acute pain related to myocardial inflammation. Interventions. Assess the characteristics of chest pain, location, duration, severity, relieving/aggravating factors. Administer prescribed analgesics or anti-inflammatory medications, example NSAIDs. Provide a calm environment to reduce anxiety that may worsen pain. Educate the patient on positioning techniques that may help relieve discomfort. Monitor for signs of worsening pain, which may indicate complications, example pericardial involvement. 4. Anxiety related to fear of complications and hospitalization. Interventions. Provide emotional support and reassurance. Explain the disease process, treatment options, and expected outcomes in simple terms. Encourage the patient to express feelings and ask questions. Involve family in care and education for added support. Teach relaxation techniques, example deep breathing exercises, meditation. 5. Knowledge deficit related to lack of understanding of myocarditis and its management. Interventions. Educate the patient about the causes, symptoms, and progression of myocarditis. Explain the importance of medication adherence, including potential side effects. Teach the patient to recognize signs of worsening condition, example increasing shortness of breath, chest pain, swelling. Provide instructions on activity limitations and the importance of rest. Emphasize the need for regular follow-up and cardiac monitoring. Prevention. Vaccination, against viruses like influenza and COVID-19. Prompt treatment of infections, early management of bacterial and viral infections. Avoidance of toxins, limit alcohol and avoid recreational drugs. Autoimmune disease control, regular monitoring and treatment. Healthy lifestyle, balanced diet, regular exercise, stress management. Complications. Heart failure, due to persistent myocardial damage. Arrhythmias, life-threatening irregular heartbeats. Cardiogenic shock, severe pump failure. Dilated cardiomyopathy, chronic weakening and enlargement of the heart. Thromboembolism, risk of blood clots due to poor heart function. Sudden cardiac death, in severe, untreated cases. Conclusion. Myocarditis is a potentially serious condition that requires timely diagnosis and management. While many cases resolve with supportive care, severe cases can progress to life-threatening complications like heart failure and arrhythmias. A multidisciplinary approach including medical, surgical, and nursing care can improve outcomes and quality of life. Patient education and preventive measures are key in reducing recurrence and complications.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.